Which of this increase absorption of iron except? Correct answer is curd. All of this is seen in anorexia nervosa except menorrhagia. Identify the image. Harmonic scalpel. Identify image. Foley's catheter. The instrument given in picture is used in thyroidectomy. The criteria for low birth weight baby 2.5 kg. Copper T380 is effective for how many years as contraceptive? Option third 10 years. Identify the blade 23. The following instrument is used to detect FHS. Fetoscope. Multiple sclerosis is characterized by progressive demyelination in the CNS. Myasthenia gravis characterized by unstable muscle weakness. The person states that he is sent by a higher diet. He will help us all and guide to the way to God. Delusion of grandiosity. Deficiency of which vitamin cause effective bone mineralization disorder called rickets. Vitamin D. Wernicke's encephalopathy is caused by the deficiency of thiamine. Which vitamin deficiency may cause night blindness? Vitamin A. Which of the following anti-tuberculosis drug cannot be given during pregnancy? Streptomycin. Clinical manifestation of dehydration include except dry and brittle nail. Facial feature of Addison disease include skin hyperpigmentation. Patient with anorexia nervosa taking food correctly as per her diet plan, but there was no increase in weight. Observe patient while taking meal. The obstetrical assessment of reveal 31102. A standardized test of gross and fine motor skill. Brewing's Ossardsky test. At what time is the short-acting insulin peak efficacy? 12 p.m. What is the cold and elevated part called? Edema. A nurse is taking care of patient with fluid electrolyte imbalance. She notices that there is redness around IV cannula. After touching, she found out that there is tenderness and IV flow is also decreased. What is correct interpretation of the following condition? The finding is abnormal. There is phlebitis. Stop the IV flow. Remove cannula. What is compression to ventilation ratio? 3:1. All are true about febrile seizure. Cerebral hypoxia is evident. Identify the given image below. Tinea corporis. A patient on assessment has been found to have hypokalemia. The nurse should consider all the following intervention except fast intravenous infusion. A patient has fallen from rooftop. Spinal injury is suspected. The emergency intervention in such cases include jaw thrust. Patient is undergoing blood transfusion and suddenly patient shows complaint of transfusion reaction. What will be the priority nursing intervention? Stop the infusion. In burn patient, isotonic fluid is given to prevent the risk of hypovolemia. Endotracheal tube formula is uncuffed child. age in years 4, below 4 year plus 4. Myocardial stress test provide following finding. ST segment changes, QRS complex, both A, B. Which of the following food should be avoided when the patient is on MAOI? Tyramine containing food. The doctor prescribed a patient to take inhaled beclomethasone and inhaled albuterol for treatment of asthma. As a nurse, how will you teach patient to take medication properly? Answer: for albuterol first, 5 minutes later beclomethasone. A nurse has just performed an NG tube insertion procedure. Most accurate method: X-ray. Calculate the total back and one arm burn percentage, 27%. During peritonitis, perform laparotomy surgery is conducted. Central line is administered in this case. What is the most important significance of the central line administration here? CBP measurement. Black lung disease is caused by coal dust. Identify the given image below. Nigel's pelvis. Winging of scapula after mastectomy due to damage of which nerve? Long thoracic nerve. The regular monitoring of blood pressure is under which level of prevention? Secondary. The drug prescription is 20 microgram. Available dose for a drug is 30 microgram per 15 ml. How much ml is administered? 10. An Anganwadi worker assesses the malnutrition status by weight for age. Most heat sensitive vaccine is OPV. Vaccine that can be freeze and still it does not lose its potency. MMR, which is the disactivated whole virion vaccine, Covaxin. All of the following diseases fall under National Vector-Borne Disease Control Program except plague. Which of the following is not included in surgical safety checklist? Counseling. Used needle are discarded in white puncture-proof container. Red fly causes which of the following disease? Typhus. Effective way to destroy the malaria larva: using Gambo's fish. In order to avoid the injury to sciatica nerve during intramuscular administration, which site is to be avoided? Dorsogluteal muscle. The amount of elemental iron in one iron tablet for mother is 60 mg. To assess the pulse in child is apical pulse. From following, which is the appropriate method of holding the baby for breastfeeding? Hold baby giving support to whole body. Inheritance shown in diagram depicted in the photograph is X-linked recessive. Identify given image. Vaginitis, chlamydia. Which of the following is a non-absorbable suture? Polyester. Normal urine output 1.5 liter. The nurse has a needle stick injury with a hepatitis B infected needle. What is priority nursing action? Wash puncture site with soap and water. Which of the following factor is a common cause of fatty diarrhea? Celiac disease. The client admitted with angina is given a prescription for nitroglycerin. The medicine should be kept in a dark, tightly closed bottle. Contraindication of liver biopsy. Increase activated partial thromboplastic clotting time in the menstrual cycle. Lowering of which hormone causes menstruation? Progesterone. On auscultation, which findings suggest a right pneumothorax? Absence of breath sound in the right thorax. Bone marrow aspiration in children. Posterior superior iliac crest. At what time period the child learn about the gender identity? 3 years. Identify the correct mask position in the given image. Option A. After thyroidectomy, carpopedal spasm occur in this the result of hypocalcemia. Pregnancy-induced hypertension is mostly due to family history. All are anti-hypertensive drug. Advice to lactating mother except losartan. Patient is on heparin. Which of the following tests required before administration? A. PTT. Most common cause of infant mortality rate in India. LBW. Failure to pass meconium within the first 24 hours after birth may indicate Hirschsprung disease. Size of cannula 18 gauge. Choose the correct statement of Trousseau sign. Ischemia induces carpal spasm by inflating the blood pressure cuff. Which of the following electrolyte imbalance is associated with digoxin toxicity? Hypokalemia. For nasogastric intubation, the length of NG tube should be measured from nose to earlobe and then to the xiphoid process. The program that aimed to train health personnel in basic newborn care and resuscitation is Navjat Sishu Suraksha Karyakram. The surgical removal of entire content of orbit including the eyeball and eyelids. Exentration. The small intestine does not involve the cecum. What should be the duration of suctioning to ventilated patient? 5 to 10 seconds. Which is the nucleus of mesenteric reflex? Mesencephalic nucleus of trigeminal nerve. The nurse explained to the mother of a neonate diagnosed with erythroblastosis fetalis that the exchange transfusion is necessary to prevent damage to brain. Which of the following should not be provided to the newborn in galactosemia? Milk. Z-track intermuscular technique is used in administering which kind of medication? Dark colored medication. Antibody A and antigen B are present in which blood? B. A client is at 35 weeks of gestation and calls the nurse at the clinic and report a sudden discharge of fluid from vagina. Based on the data provided, the suspect which of the following condition? Premature rupture of membrane. An example of positive feedback mechanism in our body. Oxytocin in childbirth. When is World Patient Safety Day observed? 17 September. What is at the back of a 2000 rupee note of Mahatma Gandhi's series? Mangalyaan. Punjab is also known as the land of 5 rivers. Which one is not part of these 5 rivers? Yamuna. Dr. S. Radhakrishnan was the first Vice President of India. The headquarters of RBI is in Mumbai. With reference to the invaders in ancient India, which one of the following is the correct chronological order? Greek sucks questionas. Select the option that correctly represent the relationship among the following animals: bird, dog, pets. Option first is correct. A person want to make a sum of 16 rupee with 40 coin using 50 paise coins and 25 paise coins. How many coins are there of 25 paise? 16. A person buy an article at 7 by 9, 7 of its value and sells it for 20% more than its value. What is his gain percentage? 54.3%. Which number is missing in the given number series? Answer third is correct. 34.